sort of get rid of this desire, but it won't go away. And, thankfully, and, I can only thank God that he agreed to having kids, and we now have our 2 children, but I really didn't think that I wanted kids. And so now, into our marriage, here I am, wanting kids and wanting to go back to church and raise kids that, have a relationship with God. And it's like, that was just not at all part of the plan when I met my husband, but
it's a 180.
A 180, but like, here we are.
Welcome to Voices of Conversion. I am your host, Addie Ray. Welcome back to another episode. Today, I am so excited to introduce you to Dr. Jessica Nazzaro. She is a Catholic OB-GYN. Our conversation today is one I am looking forward to and cannot wait to get into. But before we get started, please help this channel out by liking this podcast on any platform you're listening to us. Subscribe if you are on YouTube, and follow if you are listening on Spotify. And please rate us 5 stars. This helps me the most get this content out to people who need to hear it the most. Again, thank you guys so much. And let's get started. Welcome to the podcast, Jessica.
Thank you. Thanks for having me.
We had a little technical difficulty before we got started that was on my end, and I am a little bit frazzled from that, but excited to get into our conversation.
I am too. I've been looking forward to this.
Yes. So you are a Catholic OB-GYN, and we connected through social media through your content. And I reached out to you to see if you were interested in coming on to Voices of Conversion podcast. And you were. And I am very thankful that you're here today.
Yeah. Thanks for reaching out. I think this is, we talked a little bit before we were recording, but sometimes it's refreshing to me to talk about something other than medicine and the technical stuff and data. And this is very important to me. And obviously we connected because I posted about being Catholic. So yeah, I've been looking forward to this one.
Yes. And posting your Catholic faith online is a really vulnerable thing to do. It's something that is really scary, even if you're used to posting on social media, because I feel as though, at least in my case, you open up yourself to ridicule that you're not maybe prepared for, maybe mentally prepared for, but maybe not emotionally. So it's a really vulnerable and bold thing to share your faith online. And it's inspiring to see other faithful women do that.
I agree. And I think earlier in my content, I've only been on social media for about a year. I had no social media. I'm an introvert. I like living in the real world and having real world experiences, but I sort of, in a professional transition, got back on social media. So that's been about a year. And so early on, I really didn't say, I'm Catholic, I'm Christian. You might see a clip of me going to church, or you might see me mention that I was going to church or something like that. I sort of kept it subtle. It was very, very subtle. And then I just had a post not too long ago, which is probably the one that you first saw, where I just on the screen said, I'm a Catholic OB-GYN, and here's what I did to reconnect to my faith. And that flooded me with followers. I have a very small account, but that was sort of the first time that I just put it out boldly on the screen, stopping a scroll, apparently, for a fair amount of people, at least a fair amount of people as for a small account like me. But that was really the first time that I was very open and put it as the subject matter, instead of just sort of like subtly hinting that I was Catholic or Christian or going to church. And so that really changed a lot for me and changed my audience. But I've really liked that a lot. And I've sort of been able to lean into that instead of, just sort of hinting at it. It's become a major part of my account and a major part of what I'm transitioning to. And I'm really thankful for that. And it is vulnerable. I think recent events have shown us that it's difficult. It's a difficult time to be a Christian and to be a Catholic. But I think we all know that that's also the most important time to be open about it and to be, faithful and bold in our faith. And so I think all of that has come together in quite an interesting timing, which can only be God's timing. I mean, that's the only way it could be explained. But yeah, I think you're right. I think it's vulnerable. We open ourselves up to a lot. I mean, I've certainly gotten messages that are unpleasant, and after certain events, lost a bunch of followers, and I knew that was going to happen. And I actually said in one of my captions, you can unfollow me. I'm not the important one to follow. The important one to follow is Jesus, and that's what we have to do. And I think we lose sight of that. But I think being bold, I think it's been fun and sort of, I don't know, enlightening and, I don't know, inspiring to be bold in faith. I think it's not something I've ever really done before. And now I'm doing it, and also doing it in social media. And I'm not doing it just for social media. And like, my husband knows that I'm like talking to God. I sit with the Bible, and this is the first time I'm trying to read through the Bible and all that. So it's not just for social media, but it's out there. And so I think it's I think it's really important, and it's sort of been fun and freeing in a way. Like, okay, I don't have to just hint at this. I can just put it out there. My audience will find me, and if you don't like it, you don't have to stay.
Yes. Yes, there's something so freeing in that, and I love what you said about the one that we need to follow ultimately is Jesus.
Mm-hmm.
And there is a over influx of like what they call Catholic influencers, where it's people maybe promoting, and no hate to people that, this is how they generate their income, and this
Mm-hmm.
is, aesthetically pleasing. All those things are good. I mean, we all need to provide for our families.
Mm-hmm.
But this whole idea of like performative prayer, like people are like kind of like praying on the screen or praying like just for the camera, and maybe it's more performative and um, not as genuine as people may have hoped.
Mm-hmm.
And so, yeah, not to talk about any scandals in the Catholic influencer community or anything like that, anything that has happened in recent weeks and months, but it's important that even in our own life of creating this content to realize like our relationship with God is number one, and we should be trying to get our spouses to heaven. And then beyond that, and our children, if we have children, and then beyond that, from my perspective, when I started the social media for Voices of Conversion, is if one soul converts because of the content I'm putting out, just like the effort and the time and editing these podcasts and pushing out the promotions for it, if one person has been brought to faith in Jesus through that, that will be an eternal reward
Mm-hmm.
from Jesus. Like that is my goal. And I have to keep that perspective because my account is also growing. I just started this a month ago at the time we're recording the podcast. And you just have to have faith. Like I pray over it whenever I post. I'm like, God, you're in control of this.
Yeah.
You're in control of um, who sees this.
Yeah, absolutely. And I think, as far as, I would never consider myself a Catholic influencer. I don't even feel like I'm, knowledgeable enough to do that. But I do pay attention to the people who are talking about, Catholic teaching and the catechism. And I'm sort of, I grew up Catholic. I was baptized. I got all my sacraments, and, went to CCD when I was a kid. I forget what that stands for. But I didn't go to Catholic schools. I went to a Jesuit university, but prior to that, I went to public school. So I went to CCD, did the faith formation sort of thing. But then it was really just sort of part of my background. I think after college, it was just sort of like a box I would check if I were checking a demographic. Catholic. I really didn't practice. I certainly was not living in a way that was consistent with Christianity, or, being a good Christian or being a good Catholic. I was not doing that. So I detoured for a while in my adult life, and sort of came back. And so, yeah, I'm not a convert. I'm what you would call a revert, one of your reversion stories, and coming back to a relationship with God. So I do pay attention to some of the internet personalities in the Catholic world, and non-Catholic Christians too, just to learn. I think some of it's new information to me, and some of it's relearning maybe what I learned as a kid. But some of it really is new to me, and I was actually speaking with a nun, and I told her my age, which I won't. I'll say I'm in my late 30s. I'll just say that. And I was talking to her, and I said, I kind of asked myself, is this too late? I mean, I feel like I should have been learning this stuff with my kids. My young kids are learning sort of what I'm learning now. It sort of seems silly, or like it's too late. And she said, no, what a grace. what a grace that you're here and you have time. And really, it can't be too late unless it's actually too late, right? So, that's just kind of where I've been for the last year or so, maybe a year. I would say really, really intentionally for the last year.
I love that you mentioned your reversion because that's what I want to get into today is your story and your faith journey. So thank you for kind of starting us off on that because, you know, yeah, this is the reason why I started the podcast for people to share their stories. And it is never too late. It's not too late till you're dead.
Right.
That's when it's too late.
100.
And so, you're not too old and someone who's 95 and hasn't lived the faith and wants to get baptized, it's not too late for them either.
Right.
It's not too late for us till it's over.
Mm-hmm.
And I want to get into your story. So you mentioned you checked all the boxes. You were raised Catholic, and during your young adult years, you did stray from the church and practicing your faith. Will you paint a picture of what your life was like through your formation as a child and how your faith kind of maybe dwindled if you never had a relationship with God, besides performative acts?
Mm-hmm.
What what was that like? Will you paint a picture for us?
Sure. So growing up, I grew up in a small town in New England, and New England is, I think, traditionally been a pretty Catholic stronghold. I don't think that's necessarily true anymore, but from Irish and Italian heritage. So both of those populations are pretty heavily Catholic. Um, so I grew up going to church, a beautiful stone church. Grew up with mom, dad, me and my brother in the household. Very nice childhood. And I think, I did my sacraments with the exception, my husband and I were not married in the Catholic Church, but other than that, did my sacraments growing up, confirmation and communion, and did those. I think even then, I think it was more of just something I was supposed to do. It wasn't really, it wasn't really a practice for me. It wasn't really a relationship for me. I think it helped to have other families and my friends who were also Catholic. Most people were Catholic that I grew up with. Like my friend group, we sort of all did confirmation together and communion together. And then we all graduated high school together. It was sort of a small town, the same group of people. So I think that helped. And then when I went to college, I think it helped to being away from my parents, but still going to church because we, had a church on campus. And again, having a friend group that went to church sort of solidified the practice. But maybe I wasn't, I definitely didn't have a relationship with prayer. So I don't think I was talking to God as much as I would sort of go through the motions. And I think that probably stuck around for a while. Um, and then after college, I didn't go right to medical school. I had a few years off just figuring out what I wanted to do, and application cycles take a long time. So you apply, you don't go until the next year. And so I was working in a restaurant, which was a very, just a very helpful job and a very interesting job. But I also was drinking a lot of alcohol. That was, alcohol was something that was normal in my household, but just on a sort of daily basis, my parents would, each have a drink with dinner, maybe another drink afterwards. It wasn't really problematic. It was just sort of like a normal, I don't know, to me, it was normal. But I think I went way overboard, definitely in my 20s with drinking alcohol. And I think part of that was just not knowing what I wanted to do and not knowing what my place was. And that continued, somewhat through medical school, although it became more of like, this wine culture that I think we have is, wine is sort of marketed to us as being luxurious and carefree and relaxing. And it can be, I mean, it certainly can be, but I think I just took that a little too far because I think I just was not, again, like tethered in a relationship with God. And by now, in medical school, by then I was in my mid to late 20s, and even into residency. And then the deeper you get into medical culture, the more that alcohol becomes a problem. That's a very, very common problem for doctors, among other substances, which I really didn't get into that, but I do know people that have and maybe still do that. But those sort of substance use issues are very common in medical culture. I don't know if it's the stress of the job that sort of leads people down that road of drinking a lot or using other substances, but I was definitely doing that, and it was wine. It was just that wine culture, and really any activity was sort of built around that, like, and I think that's very common for people to, you know, have an activity, but really it's, well, what are we drinking and who's driving and all of these logistics that come with drinking alcohol or using substances. It's like your whole thought process is around that. And that's something that, even well into my relationship with my husband, we were drinking, and it wasn't until, almost 2 years ago. I haven't had a drink in about a year and a half. Not that I consider myself sober. I don't. I probably will have another drink at some point, but it really was just part of our everyday life. And I thought, because I saw that growing up, that, having a drink with dinner or maybe after dinner, and that was fine. I thought that I could do that. But it really didn't work for us. And then once we had kids, I was like, whoa, we have to rethink how we're showing ourselves here, and what sort of culture we're showing to our kids. Who are we traveling with and going on vacation with? That completely changes when you sort of rethink, is this a trip to go drinking, or are we going to go do other things? And that everything gets reoriented, or it did for us. And I also was very foggy. I was so exhausted from my job that having a glass of wine with dinner really made me feel terrible, and it made me feel very tired and foggy. And once I had my first kid, I was like, I don't want to feel foggy. Like, that's just not how I want to feel in these few hours that I have with my kid in the evening. And now I have 2 kids, so I really don't want to feel that way. So we really just sort of removed that from our daily life. And, it's rare at most. Like I said, it's been a year and a half. We went on vacation. We were excited, and we had a drink when we got there. And that was the last time we had a drink. That was a year and a half ago. So I think all of that behavior, sort of before medical school and then part of medical culture and medical training, I think all of that was just it was such a long detour from having a relationship with God. But like I said, it's not too late, but that's how I've sort of come back and reoriented around having religion and having a relationship with God.
That is just very inspiring to hear your process of going through these struggles and starting to come out of it. And I want to get into how you came out of that. But I want to circle back to a couple of things real quick. First, I just want to say kudos to you for not having a drink for a year and a half. That is amazing and very inspiring. And I hope that our listeners can take that to heart. Your relationship, I want to circle back to a couple other things, but I want to get into kind of the crux of your reversion. Your relationship with Jesus, you mentioned you were going to church in college and maybe not practicing the faith, but you hadn't really prayed. You didn't know what prayer was. How did you learn to pray? And what did that look like for you during this time? Had you met your husband yet? Were you in your single years? Kind of that time in college, will you walk us through that? And then how was prayer introduced to you, and how did you learn to pray?
Yeah, I think I'm still very much learning to pray, because even in college when I was going to church, I certainly wasn't going every Sunday, was not. But I think it was, like I said, I think it was really important, and maybe this is just all coming back now as I'm sort of on this journey, but I think it was really important for me to see my friends. We came from all different places. We didn't grow up in the same town together, but we all convened on being Catholic and going to church. And so I don't think I do remember thinking that was really awesome at the time, but I don't know that I was still really praying outside of church when I was going. And this was long before I met my husband. My husband and I met 11 years ago. So I was actually about halfway through medical school and my husband and I met. And we've just been together since. So, when we met, when I met my husband, I wasn't going to church. I wasn't, it wasn't something that we talked about. I know it's something you're supposed to talk to a future spouse about, like, how are we going to raise kids? And, are we going to involve religion or not? And all those things that you're supposed to talk about. We didn't talk about those things because it wasn't a part of what I was doing. I mean, I just, like I said, I was in medical school. I we were both sort of, I don't know, partying is sort of a way to describe it, I guess. We just really weren't living faithful lives. And that wouldn't come for quite some time. But so we didn't really get together and make a plan the way that everyone says that you're supposed to make a plan and have these things figured out. We didn't. I actually did not think that I wanted kids. And I genuinely thought that my career was going to be fulfilling and that was going to be it for me. And when my husband and I met, I said it, must have been 1,000 times. And I truly thought that I meant it at the time, that I didn't want kids. And then when I finished residency, which for an OB-GYN is 4 years, and got this job that, I thought was my dream job. And as soon as I was in this job, I just had a nagging desire to have children that I never thought I was going to have. And so then I had to think, oh, okay, now I have to tell my husband, I've sort of like gotten him into this under false pretenses. It wasn't, I truly didn't think that I wanted kids, but I had to tell him, like, listen, I have this burning desire and I can't get rid of it. I made a pros and cons list because I was trying to like weigh it out and sort of get rid of this desire, but it won't go away. And thankfully, and I can only thank God that he agreed to having kids, and we now have our 2 children. But I really didn't think that I wanted kids, and so now into our marriage, here I am, wanting kids and wanting to go back to church and raise kids that have a relationship with God. And it's like, that was just not at all part of the plan when I met my husband. But
It was a 180.
A 180, but like, here we are. And he's someone who he'll sort of participate in church and he prays and things like that. But he's not a Catholic. We go to a Catholic church, but he's not a Catholic. He wasn't really raised in anything in particular, but he is faithful. And I would say he's a believer. So, that's, very important. But yeah, we did a 180 from when we met, but so far so good.
Well,
as far as that goes. So
that's an inspiring 180. I want to touch on your time through med school and being a woman, being a working woman, not wanting kids and not practicing your faith. So did you identify as a feminist during your time as falling away from the church?
No, I think I wouldn't have said that. But I think that culture sort of took over for a while, even if I wouldn't have been able to admit it or put the word to it quite like that. And I definitely trained with people that would identify then and now as feminists. And I remember at the time thinking, well, I don't really quite agree with that, but I think this is, there's sort of like boss babe culture.
Yes.
And then feminism. And I've written about this, and I have an article coming out about this, that feminism really didn't do us any favors in this sense, in this wave of feminism. Working women and working mothers are really not new. So when we think about women in the 1950s, like my grandmother, who I never met, she was a homemaker. She baked and she cooked and she made all of my mother's clothes and her siblings, and she was very happy. And I never met her, but my mom would say she was very happy and she was very good at those things. And I have all her cookbooks. And so if you find me online, you'll see that I cook from her cookbooks and bake from her cookbooks. And there's a lot in those cookbooks that, cutouts that she has from magazines about, using good ingredients and having clean hands and all of these things that are very elevating, when I think the narrative has been that those women were oppressed. Mm-hmm. They were skilled, actually. They were just very skilled in the home. Whereas I've gained all these skills in a medical setting, in a hospital setting. I have surgical skills. It was just a different skill set.
Yes.
But it wasn't oppression versus freedom. She was very happy and she did a very, good job raising her family. And so I think that's been a big, difficult thing for me to grapple with over the last 1 to 2 years. Once I had my kids, really after my second child, and this isn't, has nothing to do with the children as individuals, but after my second child, I really had to think about the balance in my life and why I was working so much. And that all became very, very clear that not only is this job very physically demanding, and that was taking a toll, it's just harder for me to recover from being up all night than it used to be. But this was really a conflict of, between me and my family. It was really driving a wedge between me and my family and those relationships. And if we think of ourselves as, being wives and being mothers, which is what God asks us to do primarily, not only, but primarily, it really was in direct conflict with that. And I was probably in a bad place about that, because I had to think, did I do this all wrong? I mean, did I get this all wrong? Like, I shouldn't have been a doctor, or shouldn't have been an OB with such demanding hours. And that's a pretty deep rabbit hole to go down when you've invested this much time and effort into a career. And, just wondering if this was just completely wrong. I should have been a stay-at-home mom, and my husband should have kept working, and all of this stuff. But actually, I'm not that powerful. I'm not powerful enough to get it all wrong, right? So that can't possibly be the answer. And I think that and the faith that comes into that knowledge of knowing that I'm not that powerful is just how I sort of escaped that rabbit hole that can be pretty deep.
Yes.
I didn't get it wrong, but I do need to reorient my job and create boundaries and cut back as appropriately as I can to prioritize my husband and my kids, which I wasn't doing. And that's really been a big thing over the last 1 to 2 years for me, and will be in the future. Like, anything that I do going forward is going to be with my husband and my kids at the forefront, as opposed to my job and my career, which is what I always thought would fulfill me. And it doesn't, not entirely, and not in the God's way that it should.
Yes, and I want to touch on 2 points. The first one is, I forget which saint says this, and I say that a lot in the podcast because I don't have a photographic memory. I just remember these quotes, right? I think it was Padre Pio, but I'm going to put the quote for the saint right here, or put it in the comments. But that the biggest lie that the devil tells people to believe is like regret of the past. Like, the devil uses regret of the past against us more than anything. And then distraction in the present, and then fear of the future. Those 3 things is what the devil uses. So in kind of mirroring what you're saying, I had the opposite experience. So I studied criminal justice in undergrad. And if you had asked me in high school, what am I going to be? I would tell you, I'm going to be a lawyer. I want to be a lawyer. That is what I felt that desire to do. I can't do math to save my life. I can't do science. I love reading. I love writing. I'm very good at those things. Languages are things that God has naturally given to me. If you had me do long division, I would cry and it would hurt my brain, even as a 28-year-old woman.
Yeah.
But as a child, if you asked me what I would do, I would have said I didn't want kids and I want to be a lawyer. Well, I finished undergrad and I had a series of very difficult experiences in my early 20s. I ended up reassessing and deciding I wanted to take a break from school, and I got a job working as a pregnancy advocate at a pregnancy center doing pro-life work. So I was using my bachelor's degree, doing something that fulfilled me beyond anything I thought could fulfill me. In between college and working at a pregnancy center, I was a paralegal for a brief time, hated it, and got into pro-life work. Long story short, I meet my husband. He immediately lets me quit my job and stay at home. And I fell into this role of being a homemaker very quickly, and thought, maybe this is what God wants me to do. Like, law school had been in the back of my head, and I had thought, I really want to do this. But then I chose to embrace motherhood fully and being a homemaker. But then those attacks, similar to what you're saying, creep in of, what if you were a lawyer? What if, you just need to put your kids in daycare and you need to go, it's only 3 years of school. You need to do this because you're going to help so many more people as a lawyer than you would just staying at home. And it's those lies, of those regret of, you should have gone to law school just out of undergrad. You wasted these years. And I have to look back on my life and say, I did not waste those years, because I got to advocate for women and educate them out of getting to abortions and helping them heal when they had abortions. I got to do that for 3 years after undergrad. And then I met my husband, and I'm blessed to be able to bring these souls close to God. And then now I have this podcast where I'm able to, God willing, bring souls to Christ. And I didn't need to go to law school for that. And I don't need to have regret about not pursuing that. And I know I would have been a good lawyer, but I don't let myself go there anymore, because that I would have, I could have. I know it's
Right.
a lie from the enemy. And I only get one life. I only get one opportunity to live out God's call for me. And like you said, God works beyond our stupidity. At least in my case, God works beyond our, we're not smart enough to outsmart God's plan, right?
No, no, we're
And
not.
even through our sin and the darkness and falling away, God calls us back. All we have to do is say yes, and He can make beauty out of those mistakes. And I don't think it was a mistake for me to go work for 3 years at a pregnancy center. Like, I don't think it was a mistake
No.
for you to become a doctor. God can take these things that we do and turn them for His glory and amplify them in such a beautiful way. All we have to do is say yes. So I just want to say you're not the only one out there, and I think our guests can really relate. Is to the mom that never went to college and she got married and is a stay-at-home mom. Maybe she's thinking, what if I had gone to college? Or to the woman who is single and is got her PhD and trying to find her husband. She's thinking, I should have never. No, don't let the enemy get in your head. Has a good plan for you. You just need to be open to His will in your life.
Yeah, I agree. And I think that social media really does us a disservice here because it will paint a picture. Everything is in black and white. And so it will paint a picture that you either need to be a boss babe or this ultra feminist, modern feminist, or you need to be, like the trad wives thing, right? Like, and that's sort of like an insult that trad wife, like people are saying it now about Taylor Swift because she's getting married and said something about having kids. And so, they're going after her for being a trad wife. And so social media is really making that black and white when it really is not black and white. We're so much more complex than that. And I'll continue working. I just have to make work for my family. You are working right now, like you're working, but you're also a mom, and we make that work. And so I think I think social media has really done a disservice in the modern feminist movement. Again, working women. I mean, think about the Great Depression and if you haven't read Edith Stein, Edith Stein is a great, difficult read, but really important Catholic figure. And she talks about women working outside of the home. And that was in Nazi Germany when women had to go to work for economic reasons. And she talks about, women can do great in so many vocations and pretty much any vocation that a man can, bringing our special gifts and bringing our womanhood into those vocations, which means we do it a little bit differently. And so I think reading her, I sort of started reading that at a very important time when I really was thinking, okay, I got this all wrong. And I found, Sister Jane Dominic. I found an interesting article by her where she talks about Edith Stein. And then I started reading Edith Stein, and I was really reassured by that I didn't do this all wrong. And, we can't have vocations. We just have to figure out what the vocation is that we have gifts to bring to other people and how to make that work so that we can primarily be wives and mothers. And so I am very much in that transition now. So if you find me on social media, you'll see me at home. You'll see me like working at home. Home is hard work. Kids are hard work. I have farm animals. They're hard work. All of that's hard work. And I think it's about finding the meaningful work and what God is calling us to do. And I don't think that just being a doctor and sort of having this vocation, nothing else was what God asked me to do. And I still am asking God, like, what do you want? What do you want me to do? What do you see for me? Maybe here's my vision. What do you think? Does this line up with yours? Because that's ultimately what I need to be doing. So I really say that in prayer pretty much every night as I transition and move into a more passionate space for me in the OB-GYN world. And I also do writing online. I have my blogs and, I'm baking through my grandmother's cookbook and all of these things that I show online that I'm really doing in my real life. I really am always asking, like, is this what you want for me? Because this feels right to me. It feels right to be, prioritizing being a wife and mother while still using my skills and my knowledge to help women and help women's health, is this what you want from me? I don't think the calling was just to be a doctor. I think it's a lot more than that. But I think we just have to continue to ask and refine, help me land on the path that you have for me. Not what I think I should be doing, but help me find that path. And I've prayed for that for myself and other friends that I know are, have been lost and maybe need that. But yeah, I think social media has done a disservice when it comes to the modern feminist
Yes, and it
view. I
can.
mean, you can,
Oh, go
and
ahead.
I think doctors particularly, and a lot of sort of boss babe personalities online will, say, yes, of course you can do it all. You can be a doctor and also have kids. And that's true. Um, I'm a doctor and I work in a hospital and I have kids, but I also felt that deeply conflicted by that as far as where my priorities were. So yes, it's true. You can sort of do it all, but where are you putting your efforts? And when you're exhausted, where do you pull from?
Yes,
Something's got to give somewhere. And for
yes,
me, the something giving being my family was not acceptable to me. And I don't think that's acceptable to God. So
yes. And ultimately, we won't have to answer to God for the likes, our algorithm, or how successful we are on social media. We'll have to answer to God for how we treat our children. And obviously, yes, we'll have to answer to God for how we treat people in our work as well. But our number one priority should be our spouses and our children.
mhm,
And there is a way where you can have it all, but not all at once. And I
mhm,
think you can have bits and pieces of what you want in career and in children and not neglect your children.
mhm.
I do think there is, I want to get into the pivotal moment of your reversion real quick. I just want to have one little closing thought and hear your response on this as well. Um, there is a bit of a disheartening tune that I heard when I converted to Catholicism, mainly from the traditional Catholics, and I would identify as a traditional Catholic, but there are just some things like this topic what I'm about to say, I disagree with them on, is that um, there is no point in a woman going to college. Everyone should homeschool their children, like blanket homeschools for everyone. NFP is sinful. You just need to be open to life all the time, 100% no matter what. Um, I was told society went downhill when women got the right to vote. And all of those things, like, to me, were like, whoa, 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 this is a red flag. Like, if you don't want to do NFP and you want to have as many kids as God will give you, there's nothing wrong with that. But there's also nothing wrong with like prayerfully discerning with your medical, financial, psychological reasons uh, to postpone pregnancy with NFP, right? And so I had some pretty negative experiences when I was 20 and really eager to join the church, really eager to be Catholic. And was just kind of like, honestly, kind of grossed out by the things I heard from these mostly men. Um, where it's just like, I think women can do more. Like, personally, for me, my husband and I have discerned we will not homeschool. And that's just because I had a negative experience being homeschooled as a child. And I personally
Mm.
see the benefit of socialization in school. And that's a different topic, different time.
Yeah,
That's
that's a good topic though. That's an interesting one because
it
we've talked a lot about that in our household, and yeah, it's a tough topic, but it's a good one.
It is, yes, and so, like, this idea that homeschooling your kids is necessary for being faithful to the Lord. I mean, we are responsible to educate our children, but it doesn't have to look the same for everyone, or
Mhm.
that you need to stay home. You cannot have, I mean, there are some men out there that are like, "You should not have a podcast because women should not have a public voice," or, "You should not have an formal education." That is not what we're saying here at all with embracing motherhood. Um, That is one extreme. That is the opposite of the boss babe extreme.
Yes.
That is also scary and bad. Like,
Yes.
there's a healthy balance. Like, we are competent. Like,
Yes.
we are. Like, women, God did not make women dumb. God did not make men dumb. We all have our strengths and our abilities. And like you said, with Edith Stein, who is a Canaanite saint, with what she's saying is we are just as capable, and we need to bring our gifts and our femininity to these things.
Yes.
That does not mean having, someone else raise and pour into our child instead of us. There is a balance there. I wanna get your, take on that before we get into your pivotal moment of reversion.
Yeah, Edith Stein was so she was actually pivotal. Like I said, just starting to read, I'm still making my way through one of her books, but that was for me. Maybe I was just seeing too much or feeling so torn by motherhood and also career. But reading her, and she does talk specifically about medicine. Actually, she mentions that in a couple of places that no, we are primarily wives and mothers, but we have gifts to offer, and we have special gifts to offer. And I think for female physicians, we see that very much played out in the data, that female physicians very often have better outcomes for patients, and often better patient satisfaction. So patients often want, especially in my world, being an OB-GYN, patients often want to see a female OB-GYN over a male. And I think that speaks to how special we are in what we give. But back to the extremes, I like I said, I think the extremes are what play well online, and that's what people see. That's what gets fed to people. Whichever side that you're on, you're going to be fed that. But there is a balance, and I'm obviously still working on finding that balance, and trying to figure out how my gifts and my skills and my knowledge can help people while I still prioritize my family. But yeah, I think the extremes are where we just sort of start to fall apart. If you think about Edith Stein, I mean, she was writing that about 100 years ago, close to 100 years ago. Um, and knowing that women have worked and had vocation for a very, very long time, even long before that. And I'm reading a book about women in the Bible right now, and it's all of the spoken words from women in the Bible. And there are some very interesting stories there that don't exactly fit the women should be home and do nothing else narrative. I mean, there are women who are, getting their own land, or, I'm listening to the story of Queen Esther right now on the Hallow app, and, how she's just so brave. And I think we see those characteristics in women dating back to biblical times. I mean, it just doesn't fit the narrative that we have one role and we have one job and that's it. I just don't think that's true. So I think the balance is really important, and that's something that has just become very clear to me, that where it wasn't before, and especially in medical training, it just is. Sure, people have kids. People had kids in residency, and I didn't envy them because it was so demanding. But then again, my job now is so demanding. But sure, you can do it, but what are you doing well, and what are you prioritizing? That has been the biggest thing for me. Oh, I had my kids, but I also want to be present with them, and I don't want to be home on call and distracted, carrying around two phones. I'm doing this on the phone while I'm giving someone a bath. What do you prioritize? So the balance is there. We have special things to offer, to do good and to help our community and to help other people. But primarily we need to focus on our families. And that's been a very clarifying journey for the better part of this year for me.
So getting into your pivotal moment of reversion, you said you've really been into your faith for 2 years now?
Probably. I'm definitely a year. Like I said, I got on social media about a year ago thinking I professionally would need to transition. Professionally finding some more passionate space, and a passionate space that aligns more with what I think God wants me to do. So I know that God does not want me in this job or a vocation that directly conflicts with my family.
Yes.
Once that became clear to me, this was so much more than just, I don't like my job. And I told my husband, no one's going to come knock on my door and say, hey, we have something great for you. We have this dream job or this dream scenario. Here it is. No one's going to come knock on my door and tell me that. I need to build something, and I need to navigate this, and I need to find my passion and find my niche, so to speak. But all of that was in the context of, I know that God wants me to prioritize my family, which I have not been able to do. And so it was so much more than not liking a job. It was, okay, something is deeply conflicting here internally and with my relationship with God. I don't go to church when I'm on call because I'll get called, and there's no way I'm going to church when I'm on call. So there's that sort of logistic conflict, but I think emotionally and spiritually it was just conflicting. And I think once I realized that is when I started saying, all right, what do you want me to do? How can I use this job and also my faith and align these two things to help other people and help people that, see something of me in themselves. They see women's health, they see Catholicism or Christianity or faith, and they see this sort of, if you see me online, you'll see sort of a country life where we're outside, we have alpacas, we're getting chickens in like 2 weeks. So you see that sort of lifestyle, how can I use this? And so that's just where I am now. And I don't have it all figured out. And the timing is not always what I want. And that was another very important thing for me to realize, that was, okay, this isn't about my timing. This is God's timing. And so for me, patience is difficult for me to begin with, but, realizing that this isn't up to me, God will have the timing. Things that don't work out are not working out for a reason. I've had more rejection in the last year than I think I've ever had in my life. And I'm like, okay, then that wasn't what it was supposed to be. And that's not the thing that was going to work out. And so I just keep plugging away. And actually the prayer that I listened to on Hallow today was about friendship with Jesus and persistence. And I'm like, okay, I'm working pretty well. I'm doing pretty well with both of those things. So,
Yes.
but yeah, I guess it was maybe not a pivotal moment, but I think it was the clarity that came from knowing or realizing that God does not want me to have vocation that directly conflicts with my family or with my religion, my relationship with God, and then sort of settling into the timing not being up to me, the timing is up to God. I'm being persistent. How do I use my gifts and my faith to, be a different kind of doctor, I guess. And that's where I am now. And I have amazing things coming out. I have great resources coming out, new website, new products, new services from me that I think all align with that. And that's hopefully going to go well. I mean, ultimately it's up to God, and that's what I pray about. But those are sort of the things over the last year that have, in a very unsettling time, been very settling for me emotionally and internally and spiritually.
Oh, wow. That is a great place to be. I mean, even amongst the rejection, you're seeing God's hand in all of this, and you are following God's call for your life.
Another thing that social media polarizes is medicine and wellness.
Oh,
Like,
yeah.
you have to pick one, right?
Yeah.
You either want to be wellness with no pharmaceuticals and no medicine, or you're a doctor and you want no supplements and no
Yeah.
nutrition background. And those things are really not supposed to be polarized, but that's what social media does. And that's what gets views and, follows and things like that. But I am really both of those. I really like, I will use pharmaceuticals, and especially I love menopause care so much. And I use pharmaceutical, hormone replacement therapy, but I also believe in supplements, and I take targeted supplements for myself. And I want to talk about sleep, and I think sleep is really important. And I want to see the sunlight. Like, God gave us the sunlight. It was not to hide inside all day. And the rhythms of nature that we really don't use those anymore in the modern world. And so I've sort of been asking, like, how do I take what I know about medicine, but also what I value about nature, and also just sort of our lifestyle and how we try to live, without try to eliminate toxins or decrease toxins and eat whole food and real food. How do I bring that all together? And that's what I'm working on now. And so that was, I never would have thought that I would be online, like talking about Catholicism and talking about my faith and putting faith in women's health. I never thought that I would be doing this, but it feels so aligned. Not just for me, it does feel aligned to me, but it feels like, okay, am I getting there? Because I feel like I'm getting there. I hope this is right, but that's the conversation that I have with God right now.
And there's such a need for that. I would be a target audience for your products. And so I'm definitely going to be checking out your website after our meeting today to see, kind of what you're offering, because I definitely am into health and wellness, but I definitely see the benefits of pharmaceuticals as well. And there is
Yeah.
a happy medium where medical
Yes.
interventions are necessary for our well-being. I'm very thankful for modern medicine.
Yes.
And then there's also the reality that we are being poisoned through our food, and we are being poisoned through our environment, a lot of environmental toxins. And so there is a definite need for both. And it's really great that you are a resource, a Catholic resource for people to see, and you have the medical expertise. There are a lot of people that call themselves wellness coaches online, and it's like they just took a course for like 8 hours, and it's like you don't
Mhm.
really have the education to back up what you're saying.
Right.
But you do. You have the education to back up what you're saying. And so I love that. I do want to get into how your biggest question I have, and this may open up a whole conversation, which I'm very excited about, is being Catholic, we're pro-life from conception to natural death, and being in the OB world in today's climate with abortion, contraception, IVF, and this may not be in your field as much, but euthanasia. Um, how do you practice your faith as an OB, and how do you let that inform you? And then follow up on that. Have you always been pro-life? Have you always practiced pro-life medicine, or has that been something that's changed since your recent reversion to the faith?
No, that was something that was always sort of under the surface, even when I wasn't really practicing or actively praying. I think that was just something that was always there. Um, I would say that Catholicism or being Catholic is something that I would have just used on a demographic sheet for a while, but there was something deeper there because I was not influenced into that way of thinking. So I think there was obviously something much deeper than that from my Catholic upbringing. But yeah, in OB-GYN world, the medical societies that we sort of follow in our training, and we're really trained basically to follow ACOG, which is the American College of Obstetricians and Gynecologists. So that's where we get all of our guidelines and we read all these publications. And that is the crux of OB-GYN training, is learning all of these guidelines in addition to like your manual skills, your surgical skills, but you're really learning the information from ACOG, which is a very I would say a very woke corporation. It's basically a political arm. And I think a lot of us know that. The colleague that I practice with now knows that. He's been doing this for 30 years. And I practice somewhere that is, largely Christian, largely conservative. I've never been asked to, perform abortions, never been sort of forced to doing that. So I think I've just sort of been blessed or gotten lucky that really haven't been backed into a corner with that. I wouldn't. I mean, I would quit the job. Um, that's just not something that I would compromise. But in residency, at least at my program, there was sort of an opt-in, opt-out to a rotation or a month of working in an abortion clinic. So some people did it. A lot of people didn't. I didn't. When I was a medical student, I was sort of visiting an out-of-state hospital as we sort of look for places to do residency, and you go around to different hospitals visiting. And there was an abortion clinic there, and I went for one day, and I knew I didn't want to do that. And it would never. I remember in residency saying I would never be a part of that, whether it's medical or surgical. When it's elective, I'm not doing that. Now, I think this is something that the press gets wrong. This is not the same as miscarriage. So I take care of women who have miscarriages, and that's sometimes with medicine, that's sometimes with surgery. But women have early pregnancy losses. We sort of, in lay terms, call that a miscarriage. That is not the same thing. So in medical terms, those are called abortions. They're called spontaneous abortions, which is they're different types depending on how the patient presents and what her body is doing. But we take care of those, whether it's an emergency or not an emergency. If she comes in hemorrhaging, yes, she gets treatment. That's something that I think the press gets wrong. But that's a different scenario than the elective abortion clinical scenario.
Yes. Yeah.
So yeah, that's something that I have not participated in. I have no plans to participate in that. But there's a lot of opportunity to participate in that as an OB-GYN and in OB-GYN training, and really on the part of the medical societies that we're following and that produce our guidelines. A lot of it comes sort of top down from those medical societies.
That is really heartbreaking. It's just heartbreaking to see that the governing bodies over OBs are pushing murder of children, when personally, I would not trust an OB if to keep my baby alive in utero if they're busy killing somebody else's kid that's the same age.
Mm-hmm.
Like,
I
yeah,
think
it just doesn't make sense to me as a mother.
it doesn't make sense. And I think something that doesn't make sense is, okay, we do have patients that have early pregnancy losses and they have spontaneous miscarriages or spontaneous abortions. Um, and that's a loss. I mean, it doesn't, everyone reacts to that differently and women react to that differently. But, at 5 weeks or 6 weeks, if we find that, whether she's, symptomatic, she's bleeding, or we just happen to find it on ultrasound, that's a loss. Even though it happened naturally, like that's a loss. And, um, we get to be there for patients when they go through that. But yeah, it just doesn't make any sense. And I think OB-GYN, the practice of OB-GYN has become such a state of damage control that it's really disheartening. I mean, and just with how sick people are, very young women are very, very sick, with metabolic illness and hypertension and diabetes and obesity. And we are just sort of back on our heels, really in a state of damage control. And, we do ultrasounds very often, which seems very fun, right? Like you get an ultrasound, you get to see your baby, and it seems fun, but we do them so much from a state of damage control. And the other reason why they're done early is so that termination can be possible within, state guidelines, depending on where you practice. And so that is a very specific reason for doing early anatomy ultrasounds and looking for anomalies so that there's time to allow for termination. And so where I practice, if that happens in a clinical scenario, it actually gets out of my hands and goes into the hands of MFM, which is maternal fetal medicine, or high risk OB doctors. They sort of take the wheel on that in the corporation that I work for. But it really is a very interesting state of the specialty. And those are things that are just glaringly conflicting with my religion and my morals and the practice that I would like to have. They're just very obvious, but that's the current state of obstetrics practice in this country, in my experience.
I want to touch on this point that you bring up and I have seen this in my own work advocating for pregnant women. I find that women that are teetering between having an abortion or keeping their baby, they are not these maniacal, evil, in your face, feminist, rah, rah, I hate men, I want to kill my kid. These are women that are scared, that are often coerced into wanting an abortion. I have met, maybe in the thousands of women I've talked to, 5 that were truly calloused, cold, I want to kill my kid type of people. Most of the women are scared and they are lied to and they are being manipulated. And getting just to have that one-on-one, heart-to-heart conversation with a woman who is scared and vulnerable, and letting her know she's not alone, and letting her know this is the reality of your baby can feel. Your baby is alive, even at 4 weeks, even at 6 weeks. So you are ending a life. It's not just a clump of cells. This is a human being that needs to grow, but a human being nonetheless. But what I do see a lot in discussing online, because people are much more bold online, if you've noticed that as well, is confusing people. And it's a very twisted, they just kind of tweak it just enough to confuse people, the masses that may not know, telling people that the pro-lifers don't want you to have miscarriage care. And that is a lie. That is not true. And they are doing that. So then the masses who maybe don't know are believing it. Oh, well, pro-lifers don't want us to have miscarriage care. And they're saying that taking a pill to help get rid of the tissue of a already deceased child that died from miscarriage is the same as taking a pill to kill a child that was alive and healthy and would have been born alive and healthy. Can you touch on that topic on kind of for the masses that have a confusion and maybe have a disdain for the word pro-life because they think you're not going to help a woman who needs a DNC for a stillbirth? What would you tell the masses as far as just a general education on the differences in just speaking into that from your professional point of view?
Yeah, I think you're right. I think that's been lumped under one umbrella for its own purpose. And That's exactly what I mean. The term spontaneous abortion is how we describe miscarriage. That can mean we just find it on ultrasound, maybe that first ultrasound, and we get certain measurements and then no heartbeat. But maybe she's come in bleeding, or maybe the cervix is a little bit open, or maybe she's started to pass tissue and it's sort of starting to happen in that process, but she hasn't completed it. All different terms for those clinical scenarios. But if someone comes in to me, or anyone like me in an emergency, she gets care for that. I mean, there are different ways to manage that, which are going to look the same as an elective abortion. You can have a D&C, which is a surgery. You can use medication, either Cytotec or mifepristone or both, to sort of help the body with that process. If she's already had the loss, the miscarriage has already happened, the loss has already happened. If she comes into the emergency room with a hemorrhage, she goes to the OR. I mean, immediately. There's no question about that. So it's, I saw this in the organization, but when I see this in the news, I might talk to people that I know, and I'm like, this is not the same clinical scenario. It's just not. And so it has purposely been lumped together for media purposes and other sort of sinister purposes, but it's not the same clinical scenario. And it even though the methods and the technical stuff, like the medication, the surgery, are the same, it's not the same presentation that we're getting when someone comes in already having a loss.
Yes. It's the same as saying burying someone alive is the same thing as having a funeral. It's the same act, but it's a different thing entirely.
Yes.
And that is something I think the general population needs clarification on, that may not be educated as much in these topics.
Yeah, I agree, and I think that's all very purposeful. But when you hear about, someone went hemorrhaging to the emergency room and couldn't get care, I honestly don't know where that's happening. It wouldn't happen with me as a Catholic. I mean, it's just not happening. Someone's hemorrhaging, you're doing what you need to do as far as blood volume and fluid resuscitation and giving blood, but also managing the issue, which is managing the hemorrhage, which is frequently that's going to be a surgical indication, but that's exactly what would happen in an emergent situation. And so that really just gets misconstrued, and it all gets oversimplified in the media, which is not doing anyone any favors.
No, it's not. And it's a very emotionally charged issue, especially for those of us that are mothers and that have had losses. Um, if you don't know these distinctions that are very pivotal and you have that emotion charged behind it, it can get very infuriating very quickly.
Mhm.
And I am very sensitive to the topic in general, because having spoken with many women who have had abortions, it's a very touchy topic
Mhm.
because it's a deep wound when you go through that. And there is healing that needs to be done. There is healing that needs to be done that is from that deep wound.
Mhm.
I want to touch on a couple of other topics before we wrap up today. Going into how your Catholic worldview also affects different aspects of your work. One other topic I wanted to discuss with you is this notion that you need birth control to prevent having kids. And I have gone through that mindset as a young 20s of, again, I mentioned I used to not want kids, and I realized that was from my own woundedness from my childhood that I needed to heal. And
Mhm.
praise God, I've healed that. And I love being a mother and I love my children so much. And my husband and I have navigated natural family planning. And we have really we were a little shaky in our confidence in it after my son was born. But after learning a natural family planning method, I am confident in saying, we can prayerfully discern the growth of our family according to my medical needs. And that's kind of what it is right now for us, is medical. But according to our needs for our family, we can discern spacing out children appropriately. And I don't need birth control for that. And
Mhm.
it's so freeing because it's very accurate when it's used appropriately. But I wanted to go into I guess when it's how do you say, perfect use. With perfect use, it's very
Yeah.
accurate in preventing pregnancy,
Yes.
and it's been a huge blessing for our marriage. But I wanted to hear your professional opinion on this. with, having patients come in that maybe are wanting birth control, are you giving them education on natural family planning? Do you have success stories to encourage the audience with? Just kind of getting into that.
Yeah, and I will say personally, I was using birth control for a time, again, like during the time period in my 20s that I was talking about, or even when my husband and I first met, because I said and thought at the time that I didn't want kids. I was using birth control, and then I went back on it after my kids. And this is another kind of unfortunate thing about medical culture, is that to not have a period, to not be inconvenienced by having a period, is sort of like something that we look for, because we're so busy and we're so demanded by our career and however many other things. And birth control had that effect on me, and so I sort of used that as a way to not have a period. And then I started feeling like garbage, and I had awful joint pain, and I had labs checked, and my estrogen looked like someone in menopause, it makes sense. That's exactly what birth control does, right? It overrides the system and competes with estrogen, so your body doesn't make its own estrogen. And I had awful hip pain, and yeah, so I came off of it, and so I have a natural cycle, and I feel a lot better. And even though I feel the ups and downs of a natural cycle, I'm aware of that, and I think that helps. But yeah, I think what we think of as inconvenience of having a period is another sort of like ultra feminist notion that I was influenced by, unfortunately. And again, like you said, praise God that I've come around from that. But that was my personal journey with birth control. So I think an unfortunate thing about OB-GYN training is that we use birth control for a lot of things and sort of as a band-aid, like polycystic ovary syndrome, for example. The first line of intervention is lifestyle changes. We never really learn what that means, though. And so, ketosis has been shown evidence-based to help with weight loss for PCOS, to correcting the hormonal imbalances for PCOS. I never learned that in my training. But birth control will sort of mask everything and it's overriding your hormonal system, and sort of superseding your own hormonal system. And that's what we use a lot of times. And so I've talked to patients about, seeing the sunlight, and movement is very, very important. And even ketosis, which might seem extreme, but and I've definitely had patients that are like, that sounds nice, but I don't want to do that. And so for those people, I feel like I can only do so much. I also use birth control. I had someone last week who has an IUD. She does not need it for contraception. She just has, she's had cancer. She has some risk factors. She had terrible bleeding, put it in 6 months ago. She just came in to see me last week for her checkup, and she was thrilled. I mean, she hasn't been needing infusions or transfusions anymore. So we use that as a way to help her bleeding. And again, I don't know, like where this would fall with the Catholic Church. I feel like that was doing some good for her, that she's not getting regular transfusions and infusions from her blood loss. But that's using a contraceptive method to do it. So I think, I do talk to patients about side effects of birth control, which we don't typically learn, that you can have headaches and vitamin deficiencies. And we don't learn that. I learned all of that on my own, and from my own experience of having very low estrogen. And so I think women are often clued into that. A lot of people have a lot of side effects from birth control. And I think sometimes people just need to know that maybe it is your birth control, and maybe you need to stop it. If you stop it and these things get better, then that was your birth control, and that's what was doing it. And that's what I did for myself. And so I do talk to patients through that. Yeah, I think the training is really lacking on birth control from a holistic standpoint, and all the pros and cons of it. We really don't learn all that. We learn one side of it.
Yes.
But it can be used for other things. I mean, dermatologists prescribe birth control for acne. So
Yes.
it has other medical indications too.
Yes, and there's a distinction there. If you're prescribing it for contraceptive means, that's entirely different than prescribing it for a medical need. Like you're speaking about a woman who has suffered from cancer and has this bleeding that needs to be controlled. And it's the principle of double effect, I believe. So if you're not using it for means of contraception, and this is like a last resort, there's nothing immoral with that.
Mm-hmm.
It's like the same concept of having a hysterectomy, for a medical reason. This is not so you can't have any more children.
Correct.
There are lots of women that mourn the fact they have to have a hysterectomy, but
Yeah.
it's for the medical reason. And the side effect of having that medical procedure is that you won't be able to have more children. And that really is a heartbreaking thing for a lot of women. One last question
Sure.
for you. So it's one thing that I ask all the guests, and I want to see kind of where you go with this and how you loop this back into your faith and your practice. But um, going to this pivotal moment, going back to this pivotal moment of your reversion, what is one thing that you wish you could tell yourself during that time if you were there to listen?
I think I would tell myself to be more patient and be more gracious. Again, I think this is part of my personality, part of my upbringing, part of my training in medical culture is to put a lot of pressure on myself. And so I think even still I need reminding of that. Even just like today and yesterday, I've literally told myself to not put so much pressure on myself. My husband has told me that. Um, but I would tell myself to be patient and trust in God's timing. I do tell myself that still, and to not take the weight of it all on myself because it's not all on me. And I need to be reminded of that. So I think those are things that I probably would have started saying to myself a little bit sooner. Um, but I continue to say them, and I will because I think it's important.
That's a beautiful thing to tell to yourself in the past, and hopefully that speaks, and I think it will speak to people in the audience who are going through something similar in their lives. Where can our guests find you?
So right now you can find me on social media, mostly Instagram. Dr_JNaz is my Instagram handle. Right now my website, I have two. I have one for the farm and one for my doctor stuff. drjnaz.com and it'salwayssomethingfarm.com. Those in the coming months are going to be totally revamped. They're going to be all together in one lifestyle, Catholic, Christian, women's health place. So that's coming.
Wonderful, and I'll link that in the comments of this video, your Instagram, and where to find you on your website.
I have lots of good things coming. So hopefully we'll, have a great place to blend women's health and faith and wholesome living, family life. That's my goal, is to put it all together and have a community where we can enjoy it.
That's wonderful, and it's a great place to have that corner of the internet, that intersection for women that are practicing their faith and also have this need for what you offer, and this balance of working, but prioritizing your children, and
Mhm.
all of this is just it comes together so beautifully, and there's such a need for that. There will definitely be a lot of people in your corner.
I hope so. I hope so.
Yes. Wonderful. Well, Dr. Jessica Nazzaro, thank you so much for being a guest on Voices of Conversion.
Thank you for having me. This was a really fun conversation.
It has been a wonderful one, and I am sure our guests are going to love it. Again, a note to the listener, please like this podcast, share it with a friend, and subscribe. Follow me on Spotify and on Instagram. Stay close to Christ, and until we see you next time, bye.